Assalamu alaikum warahmatullahi wabarakatuh. Students, today in this session, we are going to discuss about the prescription writing for status asthmaticus. Okay, so prescription writing for status asthmaticus. So first of all, what is status asthmaticus? Status asthmaticus is an acute exacerbation of asthma which does not respond to standard treatments of bronchodilators and steroids. Okay, so this was the definition of status asthmaticus, an acute exacerbation of asthma which does not respond to standard treatments of bronchodilators and steroids. As always, first of all, we can write the biodata of the patient. So name, age, gender, weight, address, and date, etc. Okay, after that we can write the treatment for the patient. So first of all, we are going to prescribe epinephrine. Epinephrine. Okay. Epinephrine, which is given subcutaneously or intramuscularly and in 1:1000. Okay. Epinephrine subcutaneously or intramuscularly, which is given in 1:1000. Okay. After that, salbutamol. Okay, salbutamol nebulizer. Okay, nebulize. Okay, and which is up to 10 to 15 milligram he should take for 1 hour. Okay, salbutamol, which is given in nebulizer device, and its amount is 10 to 15 milligram per hour. Okay, but here notice one thing, that salbutamol is given with normal saline in 1:2. Salbutamol will be in 1 and normal saline will be in 2. Okay, and this mixture of salbutamol and normal saline is given for at least 10 minutes up to 1 hour. Okay, third, we can prescribe methyl prednisolone. Methyl prednisolone. Okay, and methylprednisolone, first of all, which is given IV and 2 milligram per kilogram weight of the body, up to 12.5 milligram per kilogram weight of the body. Methylprednisolone is given initially IV uh, with the amount of 2 to 12.5 milligram per kilogram of the body, and after that we can use this methylprednisolone only 0.5 up to 1 milligram per kilogram weight of the body up to 6 hours, every 6 hours. Okay, this was methylprednisolone, and the last one is magnesium sulfate. And magnesium sulfate is given IV 1 to 2 grams. Okay, and at the last, for examination purposes, the physician should write his signature and PMDC number. Okay, thanks a lot.